I see CCA, I see a cancer with a rising incidence and a mortality that parallels that incidence, but also one that is poorly recognised and little understood. At AMMF, we work every day to raise awareness. We know that what we see is happening across the world, and that others too are working as we are to improve the situation for all those with this most challenging of cancers. Everyone speaking to you in this video is an expert, a multidisciplinary team of those who understand cholangiocarcinoma and the problems we need to face. World Cholangiocarcinoma Day is an opportunity for us all to unite in a nationally neutral, globally inclusive way to speak out, to ask that everyone begins to see CCA as we do, and to work towards an improved future for all those with cholangiocarcinoma.
I see CCA as I've been affected by it personally myself. My name is Phil, and in 2020 I was diagnosed with cholangiocarcinoma, which came as a great shock. Since then, I've got a great team around me and doing well. I am aware that more people should know about CCA so that patients can get diagnosed very quickly, get the treatments and the trials necessary.
The reason why I think that cholangiocarcinoma is a very interesting type of cancer to be specialized on is because even though it's a rare malignancy, the incidence is increasing. In addition to this, when we are actually treating patients with cholangiocarcinoma, it's very clear how the patients can be divided anatomically between intrahepatic cholangiocarcinoma, when the tumor is arising from the bile ducts within the liver, and extrahepatic cholangiocarcinoma, which could include the hilar and also the distal bile duct malignancies. But on top of this different anatomical classification, it's very interesting to see how there are differences at the clinical stage, how the patients are presenting differently for intrahepatic and for extrahepatic cholangiocarcinoma. And even more interesting, now that we are performing molecular profiling, we also know that patients with intrahepatic cholangiocarcinoma have specific alterations, for example, FGFR2 fusions and IDH1 mutations that are less frequent in other extrahepatic cholangiocarcinoma, where we see more frequency of, for example, HER2 alterations that could be targeted. I believe all this is making the cholangiocarcinoma field very, very interesting and worth being specialized on.
I see cholangiocarcinoma as one of the big challenges in hepatology and hepато-oncology. With the dramatic increases in incidence we've seen over the last decade, identifying patients at risk and finding these cancers earlier must be one of our goals.
I see CCA as a cancer that can be difficult to diagnose. Patients are often asymptomatic in the early stages of disease, and when symptoms are present, they are rather non-specific. CCA can also be misclassified as cancer of unknown primary.
I see cholangiocarcinoma as a tumor within the liver with a rising incidence where early diagnosis is key. It's often reported to be diagnosed in advanced disease where surgical options are not given anymore. It's, however, important to see a specialist in a reference center. Therefore, look out for being referred for a second opinion.
I see CCA because it's a disease where multidisciplinary collaboration is essential. People like hepatologists, like myself, radiation and medical oncologists, surgeons, radiologists, they should all collaborate in getting the best for an individual patient in a very personalized decision.
I see cholangiocarcinoma as an heterogeneous disease with high percentage of targetable alterations. In fact, 50% of patients with cholangiocarcinoma presented targetable alterations. And in this group of patients, some publications demonstrated that the match therapy has an impact in the outcome of those patients. However, to perform molecular analysis takes time, and for this reason, we have to do it as soon as possible in the patient journey.
I see CCA today as a great opportunity to collaborate with oncologists and help them in their clinical practice by identifying actionable targets via NGS. According to the new ESMO guidelines, advanced CCA should be studied for identification of class 1 alterations mostly via NGS. So I see this as a great opportunity for all of us and mostly for the patients and their care.
I see cholangiocarcinoma because it's a disease with key nutritional considerations. A poor nutritional status can negatively impact patient outcomes, including their tolerance and response to treatment, quality of life, and overall survival. Some patients with cholangiocarcinoma can struggle to maintain a good nutritional status at varying points of their diagnosis and treatment. And it's really important that these patients are referred for early dietetic input and support. A dietitian can provide specialist, individualized nutritional management for these patients to ensure nutrition is optimized at every step of their journey.